Hello guys, hope you're all doing really well. In today's video, I will talk about the appearance of ovary in the various stages of the menstrual cycle. In this image, you can see it is the early proliferative stage with very tiny follicles indicated by the arrows. Now this transvaginal image is of the late proliferative phase, in which you can see the development of one or two prominent follicles, one of which will then eventually become the dominant follicle. The arrowheads indicate the small follicles. Now as ovulation approaches, one of the follicle becomes the dominant follicle, surrounded by other tiny follicles indicated by the small arrows. Now in this transvaginal image, you can see the cumulus ovaris indicated by the small arrow, and it is basically a cluster of cells that surround the oocyte in a dominant follicle. This follicle will then rupture and release the oocyte. Fluid in the ruptured follicle escapes and results in a small amount of free fluid in the cul-de-sac. The ruptured follicle then becomes the corpus luteum, which secretes progesterone and a small amount of estrogen to support the endometrium during the secretory stage of the menstrual cycle. This transvaginal image shows the corpus luteum, which has a central irregular cystic component with thick peripheral walls indicated by the arrowheads. On color Doppler, the corpus luteum shows a peripheral rim of blood flow, as shown in the image. In this transvaginal image, you can see another example of the corpus luteum with a central cystic structure surrounded by thick walls and a peripheral rim of blood flow on color Doppler. The corpus luteum usually does not exceed 3 centimeters, but sometimes it may become enlarged, especially when the cystic component predominates. In this example above, you can see that the corpus luteum is enlarged, measuring 5.1 centimeters, and on the side you can see compressed ovarian tissue indicated by the short arrows. So in this example, it is called the corpus luteal cyst. Sometimes when the corpus luteum bleeds internally, there is the formation of a hemorrhagic corpus luteal cyst, as shown in this picture. You can see the fibrin strands indicated by the arrow, which is a sign indicating hemorrhage inside the cyst. Now, if pregnancy does not happen, the corpus luteum stops secreting progesterone and estrogen, and it regresses after 14 days, and menstruation begins and the cycle starts again. Now let's talk about the ovaries in the postmenopausal woman. In postmenopausal women, the ovaries can be difficult to identify as there is absence of follicles, which aid in the identification of ovaries in younger women. In this example, you can see that the ovary is slightly hypoechoic, almond shaped, and its size is small, and there is absence of follicles. Now in this example of a 57-year-old lady, you can see the ovary is surrounded by a peripheral hypoechoic rim, which aid in its identification, and also note the absence of follicles. So this sums up my video. Please like this video and subscribe to my channel, and inshallah I'll come up with more such interesting content. Thank you.